My name is Jennifer Holley. I am 29 years old, and when I was 2.5 months postpartum, I had a stroke. One night after dinner, I had a really bad headache, and I've never really had a migraine before, so I thought maybe that's what it was. It was just a migraine. So I took some Advil and I went to bed, and in the morning when I woke up, the headache had actually gotten worse, and the Advil had not helped at all.
She told me, "Sean, I can't hold anything in my left arm." I took a class called Anatomy and Physiology and Exercise Prescription. I learned that one of the first signs of stroke is arm weakness. She walked out of the bathroom, and the first thing I noticed is the left side of her face is drooping. And I refer back to my class, that was another sign of stroke.
I felt like it was difficult to talk, but of course I'm not really listening to myself, so I didn't realize that it was slurred. I just thought it was difficult to speak.
And that's the third major sign of a stroke. I told her she was going to the hospital. There's no arguing about that. We were able to drive around the corner to Chowan Hospital. It only took about a good 30 minutes total. They took her back to the CAT scan. They came back, said the results were abnormal and that she had had a stroke. They came and got her, airlifted her to Vidant Medical Center in Greenville.
The neurosurgeon walked in and shook my hand and introduced himself and told me that he was going to be doing a procedure where he went through my groin to remove the blood clot.
Jennifer's situation was very atypical. Obviously, she was very young. She was relatively healthy. However, Jennifer did just recently have a child, and being postpartum, there are risks with pregnancies of having what's called a hypercoagulable state, or that their blood is thicker and that they can produce more clots than they normally would. But it's something that thankfully was recognized by her husband that she did have this stroke and to get her the appropriate care. She got a special CAT scan that we do. It's called a biplane, so it's 2 planes of fluoroscopy, or it's an X-ray machine, that when we inject dye, we can see what kind of brain tissue is still functioning, what type of brain tissue is already dead, and what type of brain tissue is stunned. And on top of that, we see if there's any blockages in the vessels in her brain. So we saw that one of the major blood vessels that contributes flow to the right side of the brain with Jennifer was completely blocked. She came in a time window that there was something surgically that we were able to do.
Had I waited 15, 20 more minutes, doctor told me she could have been paralyzed, she could have died. I'm thanking God the whole time that I was able to catch it when I did, and she's still here with me. I'm thankful every day for that.
One of the important things of Vidant Medical Center becoming a comprehensive stroke center is what it brings to the region. It's obviously the only one in Eastern North Carolina to really drive the care and coordinate with primary stroke centers and other hospitals to bring these patients in, to be able to offer premier care 24/7, 365. One of the requirements for a comprehensive stroke center is to have a neuroscience and neurosurgery intensive care unit. Not only are we able to do the mechanical thrombectomies and the procedures, but these patients are being treated by a neuroscience intensivist. After the procedure, they're being followed by someone who's specifically trained to take care of these neurovascular patients, which is key for their care. Being the ability to have a neuroscience intensive care unit, the only one in Eastern North Carolina, is extremely important for our patients.
We are very blessed and fortunate to have Vidant Medical Center in this area, because had we not had access to these medical facilities, then who knows what would have happened, you know?
I just felt comfortable because I felt like I was in good hands and the nurses really cared about me.
If you don't know the signs of stroke, it's definitely a good thing to learn.